Puerto Rico medical revalidation style question. Tachycardia bradycardia syndrome. Question. A 72-year-old man with a history of hypertension and atrial fibrillation, AF, presents with dizziness, syncope, and palpitations. His ECG shows paroxysmal atrial tachycardia followed by sinus bradycardia. Ambulatory Holter monitoring reveals episodes of rapid atrial fibrillation alternating with sinus pauses lasting several seconds. Which of the following is the best next step in management? A. Beta blockers. B. Calcium channel blockers. C. Permanent pacemaker placement. D. Adenosine. Correct answer C. Permanent pacemaker placement. Explanation: this patient has tachycardia bradycardia syndrome, sick sinus syndrome with alternating tachycardia and bradycardia. Perhaps it is a type of sinus node dysfunction seen in elderly patients with degenerative fibrosis of the sinus node. Key ECG findings in Tachy-Brady syndrome: paroxysmal atrial fibrillation, atrial tachycardia or flutter, sinus pauses or sinus bradycardia following tachyarrhythmia episodes, episodes of dizziness, syncope, or near syncope. Pathophysiology: sick sinus syndrome, SSS, occurs due to sinus node fibrosis, impaired automaticity. During atrial tachyarrhythmia episodes, overdrive suppression worsens sinus node dysfunction, leading to sinus pauses or bradycardia once the tachycardia resolves. This causes hypoperfusion, dizziness, and syncope. Treatment: first line, permanent pacemaker placement to prevent bradycardia and syncope. If atrial fibrillation is present, as in this case, a rate control medication, e.g., beta blockers or calcium channel blockers, can be added after pacemaker placement to prevent tachycardia episodes. Why not the other options? A. Beta blockers may worsen bradycardia and cause prolonged sinus pauses. B. Calcium channel blockers can exacerbate sinus node dysfunction in SSS. D. Adenosine, used to diagnose supraventricular tachycardia, SVT, but can worsen sinus pauses in SSS. Key takeaways: Tachy-Brady syndrome's alternating atrial tachycardia, AF, plus sinus bradycardia, sinus pauses. Elderly patients with sinus node dysfunction, best treatment, permanent pacemaker. Beta blockers or calcium channel blockers only after pacemaker placement for AF rate control. Would you like